Now I'd like to talk to you a little bit about the guide tube that I showed you earlier. Now the guide tube is designed to guide medical instruments from the outside of the breathing tube into the esophagus, basically using the bottom of the mask as a physiological tube to guide things along the mask into the esophageal space. Now, what kind of things would you want to put into the esophagus? Well, we know that EMS patients and patients that are higher risk for aspiration need something extra. Now, what you'd really like to do is put some kind of device to block the esophagus. Now, the airQ tip of the airQ device blocks the upper esophagus pretty efficiently, but you'd like to put something else in there. Now, why would you want to block the esophagus? Well, help to keep air out of the stomach and help to keep the aspirate out of the upper pharynx. Now, the other reason you want to put something down in there is to vent the esophagus. Might be the most important thing you can do is vent the esophagus. What are we going to vent? Again, we're going to vent air. So if air passes past the device into the upper esophagus, it'll vent out what other device we put into the airQ blocker. That's really important to keep the stomach from being blown up with air and hopefully keep the patient from vomiting. Now, there's a couple things that I like to use to put down the esophageal guide tube. One of the things is just a standard endotracheal, or standard NG tube. Now, you can put standard adult size 18 French NG tubes through all three sizes of the blocker, the 4.5, the 3.5, and the 2.5. Now, the 4.5 is for large adults, and the 2.5 is for smaller adults and adolescents, usually between 30 and 50 kilos. The large adult, the 4.5, is usually for somewhere above 70 kilos. Now, to use this device properly, you have to put it into the patient, and you have to get this tube through that guide tube into the esophagus, and what you have to do is make sure you lube it really well. Now, typically, I like to lube it up first before I put it in the patient. If you wait and you lube it up after it's in the patient, it's a little bit more difficult. Now, I got a couple tricks in doing that. So if I'm going to use an NG tube to put it in, what I'm going to do is I'm going to put some lubrication on the tip of the NG tube, and I'm going to cheat, and I'm going to put a little bit of lubrication right here inside the guide tube. Now, the reason I do that is so that as I put the NG tube in to lubricate, the tip draws some of that lubricant down the guide tube and makes it easier to lubricate the tip. If you don't put some in there, sometimes it makes it a little tough to get it down there and lubricate it. But all I do is patiently in there and I twist it, and I go slow, and I go a little slower until I get it all completely lubed through and through. Now, I usually do this before I place the device in the patient. And typically, I'll leave the NG tube just so that the tip doesn't stick out the end of the guide tube, and then I'll do my placement. So I lift the tongue, I'll slide the airQ in. Now I simply will just pass the NG tube straight down into the stomach, air up the airQ, and use the NG tube as my air vent, and to be able to decompress the stomach by putting the NG tube to suction. The other device that I like to use inside the guide tube is a device that I developed specifically for the airQ blocker, and I call it surprisingly, the airQ blocker tube. Now, what it is exactly is basically a balloon suction catheter. So on this end, it has the normal suction in. You hook to suction. It's got an open port that you can close off to suck things out. On the distal end, it's got a balloon that you can use to obturate or block the upper esophagus, and has a multi-orifice tip that allows you to vent air and also to suction stomach contents. Now, it's not designed to go into the stomach. It is designed to go into the upper pharynx, just about a half an inch or so past the distal tip of the airQ blocker tube. So, if you're going to use this device again, it's very important to set it up so that it goes through easily through the guide tube. So you want to take it out of the package, and you want to suck all the air out. So you suck all the air out of the device. Again, you're going to put some lubrication in the tip by the balloon, and I like to lube it up a little bit first like that. I usually like to use this tube to lubricate the guide tube before I put the device in, just like the nasogastric tube. Unless I've already used a nasogastric tube and to empty the stomach, pull the NG tube out, and then put the blocker tube in behind it, which is a very common way to use this. And I'll explain why I think that's important in a minute. But put the KY jelly or the water-soluble jelly on the blocker tube. Put a little bit, again, into the proximal end of the guide tube, and then use this and spin it a little bit and run it up and down and get it nice and slick. And then again, part the blocker tube just so that the tip of the blocker tube is just inside the guide tube. Again, place the device and then simply pass this device down the esophagus until the blocker tube stop meets the upper part of the guide tube. At that point, the blocker tube will be in the distal, proximal part of the esophagus, just distal to the tip of the airQ device. Once it's there, we have to find out, how do we know it went into the esophagus? It's really simple. Just inflate the cuff of the guide tube, and that takes about, it'll tell you right here on the cuff about how much, so about 10 to 12 cc's on the size 3.5 that I have right now, and that'll inflate the balloon into the upper part of the esophagus, distal to the tip of the airQ. Now what you want to do is just take a second and just pull back on the blocker tube, and the cuff of the blocker tube will come up against the tip of the airQ device and it'll get stuck. Now, I told you it's about a ½ an inch distal to the tip, so if it gets stuck really quick like this, you'll see it'll go like this, and it'll get stuck a little bit, and you'll know the cuff is past the distal tip of the device in the esophagus. In that case, all you got to do then is just push it forward, put the guide tube stop inside the upper part of the guide tube to lock it in place, and you're ready to go.